Hey everyone, Dr. Luke Pedersen here with the Knee Replacement Therapist. For today's video of the Need to Know show, we're going to look at common gait or walking impairments that you see after knee replacement surgery. Hey everyone, Dr. Luke Pedersen here, physical therapist. So after knee replacement surgery, we talked about in yesterday's video how there's different impairments, different things that are going on physically with your body, such as deficits in your range of motion at your knee, muscle weakness in your quadriceps and your thighs, as well as in your hip muscles and elsewhere through the leg. We talked about pain, we talked about impairments with balance and stability and weight shifting and coordination. And we talked about how each of these different impairments can lead to problems and difficulty with walking after surgery. And if we address those specific impairments, those things that are going on, we can then in turn help improve our walking. So for example, if you have a deficit in your range of motion, if you work on your range of motion, you're straightening, you're bending, and then you'll notice the carryover and they'll help you to walk better as well. Now, what are some of the common impairments, common things that we see that are different for normal walking to individuals after knee replacement surgery? So first thing we see is one, there's a slower gait speed. So most of the time the individuals are walking at a slower than normal speed. And this can just be an indicator of overall physical function, strength, ability, and all things like that. People, for example, in the physical therapy clinic, we look a lot at gait speed as a common indicator of ability to thrive and have good health, especially for someone who might be a little bit older. Another thing is, of course, there's decreased knee motion throughout the gait cycle. So there's decreased both extension or straightening, and there's decreased flexion or bending. So for example, we'll look at the right leg here. When you go to take a step, your knee should be relatively straight at 0 degrees. Then as you step through, your body rocks or hinges over your foot. So throughout the stance phase, everything stays straight. And now as you lift the leg, you're actually going to then bend the knee. And that's where that 60-65 degrees of knee flexion or bending comes into play. If you're not able to straighten the leg all the way, you're going to have this flexion, which means you're going to have, again, another impairment. You're going to have smaller steps, so a smaller step length or a smaller stride length is very common after surgery. So you're not able to get out straight and do that heel strike. So instead you're back here a little bit, maybe a flat foot or a forefoot contact more. So that's one thing you'll see. And then you'll see as you go to the swing phase, if you don't pick that foot up, bend the knee back to swing through, you might notice poor foot clearance. So you might stub your toe a little bit, or something that's more common is people will start to compensate for that. And so for example, you might hike your hip. You might notice people hike their hip up, or we call it vaulting. So you're kind of coming up. So you're not bending the knee enough to clear the foot. So instead you try to get that motion to pick the foot up through your hip. So you hike the hip, you vault on that other foot, trying to clear the foot, have better foot clearance. So that's knee range of motion. And then of course that leads to decreased step length, decreased stride length. It can lead to poor foot clearance, and also those compensations, hiking the hip or vaulting on that opposite foot to clear that foot as you swing through. Another thing that's common to see is decreased stance time. So we see decreased time that you're standing on the surgical leg. And so for example, when you're walking, you have periods of standing on the one leg, you have periods of standing on the other leg, and you have a brief period where you're standing on both legs at the same time. When you have knee replacement surgery, you have a lot of pain, you have some muscle weakness, decreased stability, decreased balance, and so you're actually going to spend less time standing on that surgical leg. And what that's going to lead to is, again, those shorter steps, that shorter stride length. It's going to lead to having unequal steps. So you take a nice big step with the one leg, but then you don't want to put all your weight on this leg, so you're going to take a shorter step on the other side. So decreasing how long you're standing on that leg to get nice normal steps. And so all these things together, these tend to be the biggest factors. So again, we look at the impairments: decreased range of motion, pain, muscle weakness, decreased stability and balance, and those things lead to the problems that you see, the deficits that you see with walking. Decreased step length, decreased time spent on single leg stance, standing on the one leg. You see decreased heel strike when you're stepping. You're seeing poor clearance of that foot when you swing it. And then you start to see the compensations, hiking the hip. You might see that vaulting. Another thing is the Trendelenburg, so you might see a little pelvic drop. That's more of a hip weakness issue. Or a compensation is you start to lean your trunk to the side. So all these different compensations, all these different deficits start to happen after knee replacement surgery. So like I said, one way to approach that, we address the impairments, we improve your range of motion, we improve your balance, we improve your strength, and we'll start to see better walking from that. The other thing is just practicing walking in general. You know what good walking looks like, that heel-toe, contact with the heel, push off with the toe, hinging over the leg, nice big strides, full step length. So that's something too, is just practice walking in general. And then in tomorrow's video, I'll show you some exercises that are specific to improving your walking that tend to exaggerate certain things, certain parts of the walking cycle. And in turn, by exaggerating them, we start to see that carryover and improvement in your actual walking and gait. So stay tuned for that tomorrow. Thank you very much for everyone for watching. This has been the Knee to Know Show. We took a look at some common gait impairments after knee replacement surgery. Again, as always, if you like these videos and want to watch more, please subscribe, please follow us, and of course leave any comments or questions that you may have, and I'll be sure to address them in a timely manner. Have a great rest of your day.